is from the Department of Philosophy in the College of Arts and Law. And Pete is going to be talking to us today about global healthcare justice, establishing the demands of the basic right to healthcare.
Every year, approximately 18 million people die of preventable or treatable diseases. They die of things like malaria, tuberculosis, dengue fever. They die of malnutrition and dysentery. But most of all, they die because of poverty. Every person in this room has the good fortune to be one of the wealthiest people on the planet. That might sound like a ludicrous claim, but I'd like you to bear in mind that over 2.5 billion people live on less than $2 per day. And of those people, about 1 billion live on less than $1 a day. When over a third of the world's population lives on a daily income of less than what we might spend on a cup of coffee, it isn't hard to tell the difference between rich and poor. The world's poorest people are also the most vulnerable. They're the most likely to get sick or injured and the least likely to have access to medical care when they need it. My thesis is based on the idea that every human being, regardless of their ability to pay, is entitled to at least a basic minimum standard of healthcare. Now, that might not sound like a particularly controversial claim, but there are those who would deny this entitlement even to their fellow citizens, not to mention those living in other countries. In addition, there are many who acknowledge a right to healthcare, but don't fully recognize what that right requires. I think that access to healthcare is an absolutely fundamental human right, one which enables us to enjoy our other rights and to have a minimally decent human life. My thesis provides a justification for this right to healthcare and explores what it requires and who has to do what in order to fulfill it. There are many theorists around the world working on questions of global justice. Many of them, like myself, specialize in global healthcare justice, but no one offers as comprehensive an account of a basic right to healthcare or what it requires as I do. Unlike many theorists, I don't think it's enough to merely not harm other people. I think in order for a right to mean anything, it has to provide a reliable guarantee of aid when it is needed, and it has to provide protection against the kinds of harms which are an all too common feature of the lives of millions of people around the world. I'd like to leave you with one last fact, if I may. I mentioned a couple of minutes ago that about 18 million people die every year of preventable or treatable diseases. That's equivalent to about 50,000 per day or 2,000 per hour, which means that since I started talking about 2.5 minutes ago, about 100 people have died because at some point it was decided that we wouldn't help them. The goal of my thesis is to demonstrate why this is wrong and unjust and to contribute in some small way to making that number much, much smaller. Thank you very much for your time.